Next question says, how can customer service be improved at municipal court? The clerks are very rude to citizens, and can more workers be added to make wait times lessened? Clerks behind the glass are beyond rude and need better customer service skills.
Well, I'm sorry for that. That's a challenge for us. There's not enough space in lines for individuals to get in there. It's been a paper society for so long. We are now going paperless, so you can access the computer. That transition is almost complete. We can move away from the paper. There is a game plan that would have a new court, a new facility, municipal court entirely. We're probably a year away from getting that really started, but that is on the horizon. I know that Ken has been working in the training side of the equation. If we are rude, we do need to better train our people. Mm-hmm. I know it is frustrating because when people come to pay fines, they're not the happiest of individuals to start with. And then when we can't find the record, or the record has been lost and we didn't have access to the screens, that's pretty frustrating. And maybe that frustration comes out, which I apologize for and I'm sorry for. But I think getting online will be very helpful to us, and then in a year or two, when we have a new court with new courtrooms and new pay areas and customer lobbies, I think we can move up the courtesy line, and certainly always training our people to regardless of the frustration, we need to deal politely and with respect to everyone that comes to that line.
And when you say we're transitioning to a paperless format, does that mean people do not have to physically come to the municipal court? They can go on the internet and pay their fines?
Well, you can, in fact, today go on the internet and pay those. There are certain situations where you do have to, in fact, go to the courts. But if you don't have to go and you can do it on the internet, great. You know, obviously, not everyone uses the internet, and those that don't, we want them to feel comfortable and as rapid as possible. I've stood in the line. I've before, but being able to access it by the computer as opposed to physically having to put your hands on it is going to be helpful.
What did you do that you had to stand in the line?
Well, I got a parking ticket.
Okay. And you paid it.
Absolutely.
There we go. Absolutely.
$4.
You had a parking ticket a long time ago.
Yeah.
Yeah. I've stood in that line and paid a parking ticket as well. And
that was back when you couldn't mail it in.
Right. And also there were only 2 windows.
That's right.
And yeah, that's.
But we have expanded the windows, but it's in process, and I think in a year or two we'll be a lot better off.
Good deal. Next question says, will city employees get any more furlough days this year?
Well, the way it's asked, get any more furloughs, is sort of like a vacation day. Will they be required to take a furlough day?
Yes.
I think the answer is no. Certainly not this fiscal year. We put 3 furlough days in the budget for FY12 fiscal year, which we're in now.
What is the motivation behind putting a furlough day in there?
For every furlough day, you save $450,000 in cost.
Okay.
And so
it's a money saver
it was just for a budget scenario in this year's budget that we are working on, and that we hope to present to the City Council on next Tuesday. There will be 1 furlough day budgeted.
Right.
But we hope we never have to use that. Like I said, we budgeted 3. We did, in fact, use 1. We did a flex kind of situation. But it's a budgetary issue to be able to balance the budget.
Is the furlough day a way to keep people from having to be laid off?
Well,
you spread the financial hardship, which in this case is 8 hours of lost pay versus
Sure. I mean, $450,000 on average would be probably about 10 employees. And certainly if you double that, then you're talking 20. We talked about 2,666 employees. Over the last year, we have actually got 80 less employees than we had this time last year. And I just looked at the numbers recently. 2009, we have about 180 less employees than we had. And frankly, I think we're giving good service. I think 311 has helped us. I know citizens appreciate our sanitation and our maintenance people and our sanitation people, certainly our public safety individuals. I mean, our parks and rec people are doing a great job with all the people that are coming in here. You know, everyone that's there, they're there to serve the people. They pay our salary, so we have an obligation to be as frugal and prudent as possible. And so being able to do a furlough that would save $450,000 does in fact allow us to keep employees on the payroll and not have to forcibly go with less employees.
And just to contrast, I know of one employer here in town where the employees are required to take 5 furlough days per quarter. By comparison,
it's in the news media, isn't it?
I'm not saying anything because I've got lots of friends that
but you know, I know other
sure.
governmental agencies have used that. Unfortunately, the state hasn't. They don't have the luxury, I don't think, under their statutes to do that. But it's a pretty viable and flexible way to preserve your employee count and at the same time help a budget situation. Because we can only spend what the taxpayers are willing to give us.
You're required to have a balanced budget.
Absolutely.
Each fiscal year.
And you know, we have a 10% sales tax. I've had a goal for a number of years to figure out how we can in fact get below 10%, because I think over time, you know, when you come to the big ticket items, if you can go to a place and spend 9% tax or 8.5% tax as opposed to 10%, you may be tempted to do that. I'd love for us to be able to get our sales tax at the 9, even 8.5%, to have the lowest in the region. But that would represent about $40 million. And so the issue comes, where are you going to get that other $40 million? How are you going to offset it?
And sales tax is very volatile as well. I mean, it's not dependable from year to year.
It's certainly not, and it's so regressive. I mean, the less salary people pay a higher percentage of theirs. In 2008, the sales tax revenue to the city was $98 million.
About half of our budget, about.
It's about 40%,
sure.
Yes. 2 short years later, 24 months, it had fallen from $98 million to $84 million. That's a $14 million swing that somehow you got to deal with. And the only way you can deal with that is cut your expenses or find additional revenue. Now we're back up to $91 million. We will finish this year, 2012, at about $91 million, and we're going to budget probably $92.5 for fiscal year next year. But it is very volatile. It's very economy dependent, and we would love to have something that would be a bit more predictable and a bit more stable. And until we figure that out, until we expend some energy and some resources to really study that, we're going to keep on doing what we're doing. And
let's remind everyone that 10% doesn't all come to the city. It gets divided 3 ways.
Right.
Yeah.
4% to the state, 2.5% to the county, 1 goes to education, and then ours is 3.5%.
Okay. Good deal. Next question. Why is it permissible for the black employees of a unit to make racist remarks and comments about citizens of Montgomery and toward other employees, and not permissible for white employees? They are also allowed to listen to radio shows with racial or racist comments and speeches in the office. Should this behavior be allowed?
Absolutely not. No way. If it ever came to attention at certain level, it would be dealt with. It would be dealt with severely. First of all, why are we listening to radio shows anywhere? You know, our salary is paid by the citizens to perform that service. If you're on your lunch hour, stuff like that, that's a whole different issue. But whether it be black, white, any other nationality, we're not going to tolerate insensitivity, and it will be dealt with as severely as possible.
And if it constitutes harassment, I guess city investigations could be brought in as well.
Anybody that has a specific complaint, a specific incident, can go to city investigations, and Ron Sampson and his staff will investigate that. They'll investigate that privately, confidentially, and if there are issues there, then it'll be brought to the very senior level of management, including the cabinet level that's responsible for that organization, and will be dealt with up to and including dismissal.
Good. Next question. With all of the medical care costs going up, will city employees get a cost of living raise anytime soon?
I understand that, appreciate that. We pay the exact same thing as everyone else does.
And what is a cost of living raise? How is that different from a merit raise that some people get?
A cost of living would go across the board. If you were topped out, if you're a retiree, you would get just across the board. It's all about money. Those would cost in the $2.5 million range, included in the 2013 budget, included in, since we've been there in 10, 11, 12, and now in the 13. The regular, normal step increases have in fact been funded. That's about $1.8 million. As I said, our revenue is going to go up 2.3, 2.4. That $1.8 million in the 2013 budget is going to eat up a good little bit of that. If we in fact can figure out where we can find some additional reserve, some additional revenue, then the first thing out is we would like to do across the board pay adjustment that would in fact try to help some of the increase in the medical costs that we've had to bear over the last couple of months. Actually, that number is $480 in additional premiums that they've had to pay, and it would be our goal and our desire for that to be handled, but we have chosen in this budget to take the 2.3 or whatever it is and put that 1.8 to the normal merits, because you know the state, the county, many other cities have not gotten those kind of increases over the last several years, and we've been fortunate in that we've made that a priority, and we'll continue to make that a priority. But at the same time, it is a cost issue. But we hope if there's some additional revenue, if our sales tax does increase and we can look at it in 3 or 6 months, then we could go in and perhaps on a one-time basis try to make those whole across the board.
Now, even as sales tax increases may take place, are there other revenue streams the city relies on that are actually going in the opposite direction?
Yes, actually one of the things that hit us in the head this year was we had budgeted a certain number, I think it was like $31 million for ad valorem tax that comes through the county, and that's not going to be $31 million, it's going to be about $30 million, it's about $1 million less, and so they've not given us any indication or hope that our ad valorem tax is going to be any more than what it was this year. So ad valorem tax, business licenses, city services, sales tax are all areas that we get our traditional revenue from.
And the questioner mentioned about an increase in health care premiums. Why was that necessary?
Well,
I think I know the answer already. But
simply is we are self-insured. It's the cheapest, most efficient, most effective way to do that. But unfortunately, you're going to pay for what you use.
Right.
You know, people just don't appreciate the fact that if you use an insurance cost, then somebody's got to pay for that. In our case, the city is paying a substantial percentage of it, and the employees are paying a lesser percentage, but still a substantial percentage. No one has ever said don't get sick, but what we have said is do those things that can promote the healthy lifestyle. You've been involved in trying to attack obesity and secondhand smoking, not smoking, and losing weight, and body mass indexes, and all those kinds of things to drive cost for health care down, because it's when you go to the hospital and when you go to the doc, that's why care here is so important. You can go there and for a fraction of the cost get most of your medicines free. So if we use our care here and not rely on the private sector doctor, then we are going to in fact drive our costs down. Now sometimes obviously you got to go to the private sector, and that's what insurance is all about. It's a very difficult situation, and healthcare insurance, healthcare costs have been going up double-digit now for so many years.
Every year, and it's not just us; it's every employer that's out there.
Exactly.
No copay at the Care Here clinics. Is
no
that correct?
copay is correct. That you don't have to pay your copay.